Thank you, Jenny. Chrissy Teigen, Kim Kardashian, Tyra Banks, all celebrities who have been open about their struggles with infertility. It can often be a stigmatized topic that those working in the field say should be addressed with patients before it's too late. So midway through National Infertility Awareness Week, how can you better educate yourself? Joining me now to talk about this is our friend, Dr. Jenny Hirshfeld-Cytron of the Fertility Centers of Illinois. And Jenny, thanks for coming in. We appreciate it. This is an important topic. So doctors did a survey and they found that half of women do not know when their egg supply starts declining and miscarriage rates increase. Half of women. Is that surprising?
To be honest, it's actually not surprising. This is something I see every day with my patients. I think in many ways 40 is the new 30, but unfortunately when it comes to our ovaries and our eggs, it is not.
And infertility education, it's not something that's taught in school, obviously, but a lot of women have said that they kind of wish it was. So if there was something that you wanted women to know that you find most of your patients don't, what would that be?
I think simply it would be that reproductive potential in our ovaries unfortunately have a timeline.
Okay.
And that into our late 20s, and particularly around 30, 35, is when things start to change.
So 30 or 35 is that window, right, that we need to look at?
I think 35 is probably a safe number to look at.
Okay. So if a woman does want to have children one day, what questions should she be asking her doctors? I think this is the most important thing, because I know some doctors have said, you know what, we'll let you wait a year and try and then come back to us. But if we're approaching that, age of 35, are there questions we should be asking right now?
I think when people have been trying for a full year and they're less than 35, absolutely you should seek assistance. If you're over 35 and you've been trying for 6 months, you should seek assistance. But just in general, as women, are busy, they're building their career, getting an idea of your own sort of fertility potential, doing testing like we have right now at Fertility Centers of Illinois. We have an infertility checkup, so to speak, and what that really does is give someone a gas gauge of where their ovaries are at.
So I want to get to that right now, because you have a free clinic that women can visit. What happens at that clinic and when are you offering that?
So right now at all Fertility Centers of Illinois, we have what's called sort of a fertility awareness checkup. So what it simply is, it's a blood test, it's ultrasound. If you have a partner, it's a semen analysis, and it does just that. It gives you a snapshot. So it can give someone an idea of where they are on that trajectory. So we know how old someone is, we know their chronological age, but this helps us really determine someone's biological age.
And I want to get back to that. What questions specifically should we be asking our doctors? What would you recommend?
I think simply questions to be asking your doctor is if you are currently trying and you've been trying for 6 months or a year, depending on your age, what other testing can be done to try to figure out why you haven't been successful? If you are planning your career and you're getting into your 30s, potentially thinking of things such as egg freezing, proactive ways that women now can do to really, in a sense, freeze their eggs in time so that they can worry about their professional life and then worry about their fertility later.
And are there any new ways to conceive that have popped up in the past couple years that maybe we haven't talked about?
In general, our treatments for fertility are getting better and better. I mean, I think that's the thing to take home, is that even if people are listening to this like, oh no, I'm 37, our treatments are getting better, the things that we offer have gotten better and better in the last 30 years and the last 5 years. So if you are having difficulty, you should see somebody. There's little reason not to.
Thank you so much, doctor. We appreciate it. And for more information on all the events at the Fertility Centers of Illinois and to take a fertility awareness test, you can go to fcionline.com.